Demand for at-home COVID tests has skyrocketed.
The unprecedented demand for home COVID test kit.
But at-home testing is bigger than just COVID tests, and bigger than over-the-counter pregnancy tests. In fact, it's an emerging marketplace, potentially worth over $2 billion by 2025.
Everlywell is in the #1 leadership position for consumer-enabled testing. We have experienced over 100% growth in 2021 over 2020.
There are new entrants to the at-home testing game, coordinating testing to get it directly into consumers' hands. No office visit, no middleman.
We are a wellness test. We do not diagnose any conditions. We give you information so that you can go have an informed conversation with your doctor.
Such tests can calculate anything from fertility to STDs using the same testing infrastructure built by the likes of diagnostic companies like Roche, Thermo Fisher, Becton Dickinson, as well as some of the top laboratories in the nation like LabCorp, Sanofi, Abbott Labs, or Quest Diagnostics.
70% of all healthcare decisions are based on diagnostic testing services.
Remember Theranos' intoxicating business proposal?
It turns out that the technology itself was a sham, but the reason that it generated so much buzz and so much investment was because the premise was actually correct.
It's one of the reasons we've invested so heavily in at-home testing. It is unequivocally better for the patient.
I believe it's the same trajectory as we saw with wearables in terms of tracking your steps, and this is just the next level.
So can these do-it-yourself medical tests save consumers money and still be accurate? This kind of technology has existed for years. Urine testing for pregnancy is as ancient as the pyramids.
What I think is most interesting about the pandemic is the rapid normalization of at-home testing as a common and accepted modality for medical testing.
Direct-to-consumer testing, or at-home testing, allows consumers to order lab tests directly from a company without necessarily having to work with a healthcare provider.
There's what we refer to as an at-home collection. There's an at-home test. And then there's a blood drawer in what we refer to as our patient service center. All those items can be consumer initiated.
We're not talking about genetic testing like 23andMe or Ancestry.com, but instead of tests meant to detect possible health conditions when there's no symptoms, or tests that can detect specific conditions, or monitoring tests. Now, what these tests are able to detect is expanding.
You know, we forget about the brilliance and the impact of the at-home pregnancy test. It's affordable, it's almost instant. And so you can imagine that being the case across hundreds of different tests.
Some of these companies may manufacture tests themselves, or they have their own labs to test in. But for the most part, the business model focuses on coordinating testing and making the kits easy for consumers.
Partner with some of the country's largest labs, but we also own 2 CLIA certified and CAP accredited labs.
Consumer-initiated testing industry is very fragmented.
And new companies are entering the market.
My company is Everlywell, and I'm seeking $1 million in exchange for 5% equity.
Everlywell hit it big after appearing on Shark Tank in 2017 and striking a $1 million deal.
Everlywell provides convenient, at-home lab tests with results.
Everly Health and Everlywell was on Shark Tank, and it was truly a life-changing experience, both for the business and for me. We really doubled overnight.
Everlywell sells more than 30 tests for a range of conditions. Among them, tests for Lyme disease, food sensitivity, thyroid function, HIV and cholesterol, and prices range from $49 to $259. Everlywell works with labs nationwide. So does My Lab Box.
My name is Laura Ivanova. I am the co-founder and CEO of My Lab Box. We've expanded beyond our initial focus on sexual health into a lot of other categories like wellness, COVID testing, fertility, cancer. Early detection is instrumental in saving lives. We've seen even large lab companies like Weston and LabCorp step up to the challenge and launch at-home testing.
We believe in empowering consumers to access healthcare, and we thought this was a fantastic opportunity. Quest Direct, we're offering the same tests that we offer to doctors and hospitals. So we launched it in 2018. So if we think about 2020, we doubled our revenue versus 2019. And if you were to include COVID, our revenue increased 8 times versus 2019.
When we were in early quarantine in 2020, we actually saw a rapid escalation of sales of our STI tests. And that has continued. I mean, in the 200 to 300% continuous year-over-year growth. And then women's health grew 400%.
Meet Modern Fertility, the test that teaches you about your eggs and fertility hormones.
Hi, I am Afton Betchery. I am a co-founder of Modern Fertility and now run the women's health division of telehealth company Ro.
She started Modern Fertility after realizing getting her own fertility information proved more difficult than she thought it would be.
I, when in my next appointment with my OBGYN, asked for them to order that panel of tests. And they said, no, Afton, you're not trying and failing to conceive right now. We're not going to order them for you. Just wait and see. When I got these tests done, I actually received a bill in the mail after for $1,500. And that was totally unexpected to me. And so we really wanted to bring this to market in a way where we could provide access for as many people with ovaries as possible.
Such startups are reaching big valuations, like unicorn level, before hitting the public market. Like Everlywell, it may be valued at $2.9 billion. Another is Ro. Ro was valued at $5 billion in March 2021, and it's made some big acquisitions like Modern Fertility and Kit.
Kit is a window into the future. Imagine an at-home physical in a box. So what lands at the patient's door is oftentimes a blood test, a saliva test, a scale, an at-home blood pressure cuff, and they are guided through with no paper instruction, just an app. They'll collect all of the samples that they or their provider have recommended, put it in a box, ship it back to our lab. We'll run all of the tests and then return the results to them and their provider.
The samples are received by trained laboratory staff and run on routine laboratory instruments. Results are generated and released to the customer. We then have a couple of additional follow-ups that I think as a physician are incredibly important to ensure that these tests are used properly and that they are meaningful to patients and customers.
Many companies, including MyLabBox, Modern Fertility, Kit, and Everlywell, say its tests are run through labs that are CLIA certified. And CLIA stands for the Clinical Laboratory Improvement Amendments.
With the case of at-home testing, the quality controls and measures are put in place by CLIA. This is the body that really governs the quality of laboratory work. The FDA has traditionally not regulated each and every at-home test.
Not all direct-to-consumer tests are reviewed by the FDA. For the most part, at-home tests for non- or low-risk medical purposes are not reviewed by the FDA before they hit the market.
The results that we provide are lab-certified results. They're just as actionable as the results that you get in a clinical facility. The truth is that companies like us go through rigorous screening before we deploy products.
The FDA recommends taking precautions when doing at-home tests. For example, such tests should not replace periodic visits to a doctor, and most tests are best evaluated together with one's medical history, a physical exam, and other testing. One of the biggest problems is this testing may provide consumers with raw results that are difficult to interpret.
The results are presented with context, what we were testing for, what we found, in some cases pointing to resources and references to help you learn a little bit more about the test and how professional societies and clinicians think about the testing and how it should be used.
Another issue is the potential for incorrect self-diagnosis if consumers misunderstand their test results, leading to unnecessary testing, medications, or procedures. Or the opposite could happen. Someone may not seek out the necessary follow-up care. Plus, questions about accuracy may also rely on how consumers are following test instructions.
First and foremost is that if you don't have a good specimen, you're not going to have a good test, right?
If there is an issue with sample collection, the lab staff flags that when they receive the sample and alert our customer care team, who then reaches out to the customer to offer a replacement kit or help to troubleshoot.
Even minor errors can affect test results.
By and large, the self-administered tests are less expensive and they're easier to mass produce.
And these companies say their tests are typically priced lower than out-of-pocket costs associated with office visits.
In-lab tests do tend to be a little bit more expensive.
Pricing can get complicated and is not always transparent. And of course, pricing varies by laboratory, test type, one's insurance coverage, among other things. However, most insurance companies don't cover at-home tests.
When we think about consumer-initiated testing, we've always thought of it as a consumer paying out of pocket.
For example, Everlywell and MyLabBox are not partnered with any insurance companies.
Working with insurance companies for the providers can oftentimes increase the cost of service. We made this a cash model. The price is the same for absolutely everybody, no matter of your insurance status.
We don't accept insurance. Removing the administrative burden of insurance, we can oftentimes deliver a better experience at a lower price. That's one of the reasons why we built our own lab as well.
Generally speaking, some tests can be covered by flexible spending and health savings accounts, because oftentimes these tests are authorized by a physician on the back end. That fits guidelines for most HSA, FSA coverage. Certain at-home tests are more likely to be covered by insurance than others.
We can actually tell you upfront what you'll pay. A great example is our fertility test. Fertility tests often cost people $800 to over $1,000, and we're able to offer them much lower price points and covered by your HSA.
A lot of the tests that Modern Fertility has enabled are often not covered by insurance.
Modern Fertility says that even if a patient asks their OB/GYN for a fertility hormone testing prescription, it often isn't covered by insurance. Only 17 states cover fertility testing for patients who have already been diagnosed with infertility.
It was important to us that we were able to bring this very accessibly priced product to market. So today our test is priced at $159.
All in all, the best way to determine whether or not an at-home test is covered by an insurance provider is to contact them directly and discuss coverage.
Do you think that there's a future where insurance is more integrated with these at-home tests?
I do, and I hope so. And I think it's coming soon. I mean, I think we saw with kind of the Biden administration, the mandate for insurers to cover a certain number of tests, of COVID tests every month. I do think insurers are starting to become aware they would pay less for the downstream care of the individual.
I think that we'll see a kind of a combination of people wanting this information more, companies having much invested a lot in the technologies and having investors that invested in the technologies, so they'll want to get a return on that investment by growing the market.
Take Roe's acquisition of Kit and Modern Fertility as a sign of its optimism in the at-home test marketplace.
We've invested hundreds of millions of dollars over the last year into at-home testing.
The initial years were years under the label of kind of skepticism and friction. So I think there was just a lot of pushback. Why you? This will never work. If this would have worked, it would have already existed. Nobody will trust online company to buy their wellness products from them, et cetera, et cetera, et cetera. In this entire time, we've remained strong believers in the fact that you can't have progress unless you radically change the paradigm in which you operate.
The genie is out of the bottle in many ways. In a post-COVID world, we're not going back.
The future is so bright in testing, and we now have all of the tools, I think, to really make it mass market. I think that opportunity is just scratching the surface as we come out of COVID.